for a first-time patient who wants a healthy vaginoplasty, is there something that you think would be recommended?
I usually ask the patients 2 or 3 questions. The first question is, what is the depth that you want? That is very important because there are certain patients who would straight away say that we want a depth of 6 to 8 inches. For them, modified penile inversion vaginoplasty is not the procedure of choice. So we can rule it out straight away and talk of the options like peritoneal and sigmoid. So the depth is very important. Second is the hair growth in the area, because below an anal canal there is a strip of 5 to 6 centimeter wide. We usually use that in our perineoscrotal flap for a modified penile inversion vaginoplasty. If there is hair growth, we ask the patient to go for laser hair removal 6 to 10 sittings before coming. Otherwise, hair can grow in the vagina. So these are the 2 things that I ask all the patients.
And what is the procedure in FORTIS from the admission to the surgery bed? What happens to the patient? Can you guide us through?
So I'm talking mainly about trans women right now. We usually provide a written estimate to the patient of the procedures, so the patient knows what to expect. And in case of peritoneal or modified penile, patient on the same day as surgery at usually 8 a.m. and patient to fast overnight so that from midnight patient is empty stomach, she comes. And surgery for modified penile inversion is 4 hours, and for peritoneal and sigmoid to 8 hours. And then patient undergoes the surgery. The admission time for modified penile inversion is 3 to 4 days and 4 to 6 days for the other 2 techniques. In case of sigmoid, we admit the patient 1 day earlier because that day patient undergoes the sigmoidoscopy. So to rule out any illness in the sigmoid colon, so that should not be transferred later on to the vaginal cavity. It rules out any illness so that procedure is safe for the patient. The sigmoidoscopy can also be done before admission at a different episode, and then patient will admit on the same day as surgery. And generally at day 4 to 6, most of the patients are discharged if they are living in Delhi or if they are from abroad or from other states. We usually start dilatation at day 7, and we ask the patient to bring their own set of dilators, or we also have few sets available with us to arrange. We usually teach the patient dilatation on day 7. Patient is expected to dilate for 15 minutes around 3 times a day for initial 3 months, and after that frequency goes down considerably. So this is the regimen.